everyone, my name is Nierenberg and I am going to be giving you your final review session today for Neuroscience 301-01. Okay, so the first topic that we're going to go over is movement disorders. This was covered in week 8. So in the week 8 we had a guest lecturer, Terrence Sanger. He is the Chief of Scientific Research at Chalk Hospital here in Orange County. He came in and talked to us about some research that he's doing in dystonia. As you can see down here, in 1993 he graduated from Harvard Medical School and then did his residency in pediatrics at USC in 1995, and then in 1999 he did his residency in neurology at Boston College. So he currently works at Chalk Hospital in pediatric neurology, and he's researching dystonia currently. So what is dystonia? So dystonia is an involuntary adaptation of abnormal postures of agonist and antagonist muscle contractions that become so rigid the patient is unable to maintain normal posture. So most often it's caused by lesions in the basal ganglia. This is an image of a child who suffers from dystonia, as you guys can remember from our week 8 lecture. So what is currently being done to treat dystonia? Currently, Dr. Sanger is working in deep brain stimulation. This is where they place electrodes in the brain to stimulate electrical responses to different areas of the brain to try and regulate the motor cortex. This is done to currently treat the symptoms of dystonia and not so much of treating dystonia itself. So, acceptable topics for your short answer response in this section would be to talk about how these electrodes are signaling different impulses to areas of the brain to regulate this posturing. It being a mystery of the brain itself that we don't really know where these electrodes are being placed and what exactly it is kind of sending an impulse to, if this is actually helping or causing more harm. We also don't know if this is a long-term fix, if this is something that's being done in the short term, or if these people have kind of these everlasting effects and it will cure their symptoms altogether. As I stated earlier, we don't know if this is causing more harm or good to these patients, and we also haven't seen the study being conducted on adults yet, just so far on these pediatric patients, and before that he mentioned that he was conducting the study on monkeys as well. And as I stated earlier, it's done to treat the symptoms, not the actual dystonia itself. So the next topic that I'm going to discuss is artificial intelligence. This was covered in week 14. So what is AI? So AI is intelligence done by kind of machines and our various technologies to any extent. So AI started in the 1950s, kind of after The Wizard of Oz, based on the idea of the Tin Man. And after this point, a bunch of scientists, mathematicians, and philosophers had this kind of idea of AI and to what extent we can use it in our society. So we're going to kind of dive more into this. So today, we are seeing AI being used in fMRI brain fingerprinting. So what this does is it monitors information by measuring brain waves, and they're going to gather all of this data to make a unique fingerprint per person. So this is being used to predict different personality traits, aggression, IQ, behavioral aspects, and can be used in some crimes to see if people had that behavioral or aggression during that moment, or if this is something newer. The extent of knowing how reliable this is still up in the air due to it being such a new kind of advancement. So an example of realistic AI is Xiaowai's. And she is a AI that is being tested to have conversations with different people. And her kind of programming is that she can recall conversations and know appropriate responses. So overall, after people talked to her, they said that they had a feeling that it was another person and that they didn't know it was an AI itself, which shows how advanced we are getting with these AIs and to what extent they're able to communicate and process information. So acceptable topics for your short answer in this section would be that AI doesn't understand the why. You can program this device to do anything, but it can't really comprehend what it is doing and the purpose of that in a bigger picture. It could also be used to help us understand the brain for brain mapping and future kind of studies to that extent. But on a bigger scheme of things is having more machines that can do harder tasks for us, making us lazy. If this idea is that AIs can facilitate our jobs for us, why wouldn't we do it ourselves? Another thing is, could they be doing more harm than good, as well as it's making us more dependent on technologies? So some topics that we didn't necessarily talk about in this course but are still important and could possibly be on your exam are childhood development. So this is a really important topic because if we don't understand where our brains kind of originate from in developmentally, we can't understand more research and future studies. So if we don't understand what factors can influence our behaviors and our personality and how we function, we can't figure out kind of the bigger questions like consciousness or free will and various things like that. Another thing is behavioral neuroscience, kind of understanding where in the brain certain things are processed and how that makes us react and function in the real world setting. This is really important to understand kind of how our brains work and how we act the way that we do. And our final topic is case studies. We need to have realistic examples so we can understand things as a society in a more realistic, hands-on way. This also makes information more personable for the class because you guys are able to see this as a whole and try and break it down and process things on your own without just kind of hearing about it in a textbook. You're able to understand it from a real person's point of view. And this is my bibliography. Thank you.